And it's a story that we continue to follow as health officials confirm in a tweet that 2 more cases of orthopoxvirus have surfaced here in our city, presumed to be cases of monkeypox. News 12 reporter Phil Tate joins us, and he just spoke with a scientific officer all about treatments as cases continue to surface. Phil.
Yeah, Christy, and according to the New York City Health Department, a total of 4 people have now tested positive here in New York City. Well, as we see these cases here at home, the big question some may be wondering, what are the treatment options when someone is diagnosed with the virus? Well, moments ago, I spoke with an expert about a drug called TPOXX, an antiviral treatment that's been approved by the EMA in Europe for orthopoxviruses, which includes monkeypox. While here at home, the FDA has approved the treatment method for smallpox, and it has been used on a compassionate use basis for the treatment of monkeypox.
Molecule that was developed originally as an antiviral to treat smallpox in the event of a recurrence of a pandemic. During its development, it was tested against a number of different viruses in the same family. They're called orthopoxviruses. And so certainly we have data that it works against monkeypox, cowpox, vaccinia, and others.
And Dr. Ruby says this treatment method can be taken by mouth with 3 capsules twice a day for 14 days. He says for the past decade, the drug has been used in a number of compassionate use cases to treat vaccinia, cowpox, and monkeypox infections. And in all cases, there have been positive outcomes with this use of the treatment method. Well, here at home, health officials are monitoring the surfacing of the disease that is usually found in Western and Central African countries and doesn't occur naturally in the U.S. Well, while there's no link to travel and presumed cases right now, it's always important to be aware of symptoms, which include fever, headache, muscle aches, swollen lymph nodes, and rashes. Well, for Dr. Ruby, he says it's important that we all pay attention.
What we don't know is, like with COVID, you can have mutations. This virus could learn how to go person to person by the respiratory route, and then it would be a much more serious problem. So I don't think that we should be worried, but we should take appropriate cautions and pay attention.
Good advice there. And as the health department continues to monitor the issue, they say they'll be doing contact tracing. And of course, we'll have the latest here on News 12 as we continue to stay up top of this health issue. Christy.
Phil, thank you for breaking that all down for